BasicNeeds was founded by Chris Underhill in 2000. Chris is a serial social entrepreneur who also founded Thrive, a UK-based non-government organisation which uses gardening to bring about positive changes in the lives of disabled people, and Action on Disability and Development, an international non-government organisation working with disabled people living in poverty in Africa and Asia.
BasicNeeds was my response to the huge lack of mental health care in low and middle income countries. We developed a new approach, which in the end we call the BasicNeeds model for mental health and development, or the BasicNeeds model, in order to tackle this problem.
BasicNeeds started its work in India in 2000 and quickly expanded to Sri Lanka later that year. Since its foundation, the organisation has helped hundreds of thousands of people with mental illness or epilepsy, their families and carers in countries such as Ghana, Tanzania, Kenya, Uganda, Vietnam, Nepal, China, Pakistan, Laos and South Sudan.
According to the statistics provided by World Health Organization, we are all aware that close or more than 450 million persons globally suffer certain forms of mental disorders.
In fact, 1/3 of the global population live in countries that allocate less than 1% of their total health budget to mental health, meaning there is a huge lack of community-based facilities and many individuals receive no care at all.
Well, BasicNeeds was set up to ensure that mental health gets the attention it deserves, particularly in low-resource settings. As we grow and develop, we're reaching more people than ever before, mainly through the delivery of our model.
The BasicNeeds model uses meaningful work and community support, as well as treatment and policy change, to help improve lives. It focuses on improving a person's mental health through care and support, and if needed, treatment, and addresses the stigma and poverty so often associated with mental illness or epilepsy.
The approach involves bringing people together to provide peer support and helping them to get back to work, school, college or even productive work within the household. We also provide support to carers and families and help educate communities about mental health.
The model aims to demonstrate that cost-effective community mental health care can be introduced into poor communities and be successful in delivering sustainable impact and change. By working in partnership with mentally ill people rather than simply for them, BasicNeeds has built a unique and effective model for recovery and sustained good mental health.
So how does our model work? Well, the BasicNeeds model focuses on 5 core areas: capacity building, community mental health, livelihoods, research and collaboration.
Capacity building refers to strengthening the skills, competencies, and abilities of people and communities to improve the lives of people living with mental disorders. Capacity building is also about building the capacity of the system and organizations to encourage the sustainability of solutions.
Community mental health help to make treatment services for mental illness or epilepsy more easily available to the community, more effective and more affordable.
Livelihood is about facilitating opportunity for affected people to gain or regain ability to work, to contribute to their family and community.
Research involves generating and applying real-world evidence to enable those operating the basic needs model to continually improve support and services provided, show level of improvement on people served, and advocate for change.
Collaboration is where we look to forge partnerships and maintain good relationships with various stakeholders to improve mental health provision.
These 5 areas form the backbone of our work, and the way they come together in the Basic Needs model is what makes us unique.
Our approach includes providing medication and psychosocial support in partnerships with local governments, ministries of health, local organizations and communities. It is a low cost and sustainable because we build the capacity of existing health professionals, community organizations and communities rather than starting from scratch. We also build the capacity of participants by encouraging them to be members of self-help groups, to support their ongoing recovery and to reduce stigma by helping the broader community to understand what mental illness is.
We create livelihoods opportunities for people affected by mental illness or epilepsy. Our research shows that chances of long-term recovery are hugely improved by working and from the pride of being an economic asset and a contributor to family and community.
The combination of our hands-on practical work with rigorous research and data collection supports people with mental illness or epilepsy to make their voice heard at a local level. It also allows us to collaborate with a range of partners to advocate for and create change at a local and national level, and increase the prominence of mental illness or epilepsy on the global stage.
The Basic Needs model makes a tremendous difference to the lives of people living with mental illness or epilepsy, their carers, families and their communities around the world. If you'd like to find out more about the work that we do, then visit basicneeds.org.